Hello folks, welcome back. This is Kweku. I'm a pharmacist. This channel is dedicated to healthcare information as well as pharmacy stuff. So feel free to hit the subscribe button if this is something that you find interesting or useful. In today's video, we'll be taking a look at the medication Metoprolol. We'll take a brief look at what it is. We'll take a look at the dosing. We'll also take a look at its uses, both FDA and non-FDA uses, that is off-label uses. We will obviously take a look at some side effects, as well as some precautions or some best practices if you are taking metoprolol or if you are considering it. Just a little disclaimer before we start. This video is for informational purposes only and is not intended to be a substitute for medical advice from your physician. Please continue to follow any specific instructions provided to you by your local healthcare provider or providers. Metoprolol belongs to a class of medications called beta blockers. And at a very high level, beta blockers exert their effect by inhibiting the action of adrenaline or epinephrine on the heart muscles or on the blood vessels. I must say that metoprolol is said to be cardioselective. That means it exerts its effect more on the heart relative to the blood vessels. This inhibition of adrenaline or epinephrine ultimately leads to a reduction or a relative reduction in the heart rate, as well as a reduction in the force of contraction of the heart. A reduction in the force of contraction of the heart or the heart rate ultimately leads to a reduction in blood pressure. That leads us straight into the uses. And the number one use obviously is the use in hypertension or to lower high blood pressure. Other FDA approved uses include in the use of angina in the treatment of congestive heart failure. The off-label uses include in acute myocardial infarction, that is when you have a heart attack. It is believed that, or it is proven that when you have a heart attack, survival rates increase dramatically if such patients are put on a beta blocker, typically maybe 3 to 6 months, or for some people it may be indefinite depending on the individual circumstance. Other uses include atrial fibrillation or other cases of abnormal heart rhythms. It can also be used in the prophylaxis or prevention of ischemic heart disease. Now, ischemic heart disease is a situation where there is inadequate supply of oxygen to the heart, which may cause pain and other issues. Next, we'll take a look at dosing. And dosing may vary depending on what condition it is being used to treat. Your average dose though may range anywhere between 25 milligrams to 100 milligrams. That's typically what I see on a regular basis. I've also seen doses as low as 12.5 milligrams and as high as 200 milligrams daily. I must say that the literature says that the maximum dose is 400 milligrams and that no studies have been done with respect to people taking more than 400 milligrams. And to be honest with you, in practice, I have not seen anybody take more than 200 milligrams per day. Okay, now we will tackle some side effects or adverse reactions. For the most part, metoprolol is generally well tolerated. There are few incidents of side effects, but they generally tend to be mild. There have been reported incidences of hypertension where the blood pressure drops too low, or for some people, the heart rate may drop too low, which needs to be addressed. It's quite rare, but it can happen. There have also been cases reported of rash or people itching while taking metoprolol. There's been incidences of the usual suspects, diarrhea, dizziness. Dyspnea or shortness of breath has also been reported, as well as fatigue, which people complain of, being tired all the time. Some central nervous system side effects may also be experienced with beta blockers in general. Obviously, metoprolol is a beta blocker. Some of these include depression, vivid dreams or nightmares, and there's also even been reports of hallucinations. I must say that these are very rare, but generally beta blockers have that potential to cause that, so it's worth noting. Another rare but reported side effect is erectile dysfunction or a decrease in libido. And like I always say in almost every video that I talk about medications that have the potential to cause this, the solution is not discontinuing your medication. The solution lies in discussing with your provider to find an alternative. And I keep coming back to this topic because practically I see every day where people discontinue their medications for this particular reason, forgetting that the dangers of not taking the medication are also relatively important or are very important and need to be taken into consideration when you take such a decision. Now let's switch our attention to some precautions or some best practices. The first one is to avoid activities that require mental alertness until you know how your body will respond to the medication. This is because metoprolol can cause dizziness. So until you know how your body is going to react to it, it's best to stay away from activities that require mental alertness. The next precaution is for diabetic patients. Diabetic patients should also closely monitor their blood sugar levels if they take metoprolol. This is because metoprolol has the potential to mask some of the symptoms of hypoglycemia so that your blood sugar goes too low, but ordinarily what would have warned you or alerted you, those symptoms may be masked by metoprolol. The other precaution is not to discontinue metoprolol abruptly, as this may precipitate hypertension, angina, or even in some cases a heart attack. Caution should also be exercised in people with severe liver disease. Since metoprolol is extensively metabolized by the liver, dosage adjustments may be required in people with liver disease. The general recommendation is to start such people at relatively lower doses than what is normally recommended, and then work your way up until you achieve optimal therapy. Caution should also be exercised in people with hyperthyroidism. This is because tachycardia, or increased heart rate, is a very useful monitoring parameter in people with hyperthyroidism. The only problem is that metoprolol may mask this effect. Also, abrupt withdrawal of metoprolol in such people is highly discouraged. This may lead to a condition called a thyroid storm, where the blood pressure, the body temperature, and the heart rate may rise to very dangerous levels, sometimes even to life-threatening levels. So, though metoprolol should never be discontinued abruptly, it is more so with people with thyroid disease. With all that said, I still believe that metoprolol is still a good medication. I have personally dispensed thousands of prescriptions of metoprolol over my career, so feel comfortable taking it. If you have any specific issues, don't forget to discuss that with your provider for an alternative to be found for you or for a solution to your individual problems. Thank you so much for staying through. Don't forget to subscribe if you haven't already done so.